Go to Mr. Green for 6 minutes, please.
Thank you very much, Mr. Chair. Is Dr. Tam within that room?
Yes, she is.
Thank you very much, Mr. Speaker. Before I begin my remarks, and I'm going to put some very direct questions to this committee, I want to make a personal statement to Dr. Tam that the public comments that were made to you that cast negative aspersions on your professionalism and loyalty were racist in both their intent and their impact. And I believe that they contributed to xenophobic attacks across the country. And for that, I wanted to make sure that I went on the public record today to say how deeply sorry I am that you had to experience all of that. And now on to the direct questions. I will ask that there also be a direct response through you, Mr. Chair, to the Honourable Minister. Did the Public Health Agency of Canada warn the federal cabinet at any time in the last decade that the National Emergency Strategic Stockpile was not funded or mandated to amass sufficient levels of medical supplies and equipment to respond to a pandemic like COVID-19?
Well, thank you. And through the chair, I'll just say that I've only, before the pandemic outbreak, I had been the minister for a month and a half. So I was just in the process of learning about all the agencies that I would then have the responsibility for. But I will say that the agency has been extremely responsive in terms of indicating to multiple governments the needs in which they have. In fact, the agency was actually working on renewing and looking at its.
Honourable Minister, if I can ask directly, were you a minister prior to becoming the Minister of Health?
Yes, I was.
Were you ever briefed at the federal cabinet at any time in the last decade that the National Emergency Strategic Stockpile was not funded or mandated to amass sufficient levels of medical supplies or equipment to respond to a pandemic like COVID-19?
Well, I can't speak to the 5 years prior to our government, where in fact under the Harper Conservatives, the agencies experienced significant cuts. But I can tell you that during the 5 years that we were in government, in fact, we increased funding to Public Health Agency of Canada. In 2014-15, the funding was $637 million. We increased that funding by 6%. In 2018-19, PHAC's funding was $675.4 million. I say this because that's actually the nature of how these conversations happen at the cabinet. It is rare that a minister would come forward with a specific request about a specific item line, but rather submit those budget proposals to, as you know, the finance minister, and work directly with the finance minister unless it was changing a program in its specific nature.
If I may refresh your memory, on April 1st, 2020, in a news conference, you admitted that the federal government likely did not have enough protective equipment in the National Emergency Strategic Stockpile to meet the needs of this pandemic by saying we likely did not have enough. I think federal governments for decades have been underfunding things like public health preparedness. In your view, has the National Emergency Stockpile been underfunded for decades?
I think I'll just refer to my quote. I do believe that public health has been underfunded for decades. I do believe that we don't spend enough money on prevention, and that would include preparedness. So I stand by that statement, but I also understand that the National Emergency Stockpile was actually never meant to accumulate personal protective equipment, but rather other kinds of treatments for all kinds of biological events.
I'm still, unfortunately, unwilling to accept that as an answer, but I will go on. The Public Health Agency of Canada whistleblowers recently informed the Globe and Mail that PHAC did not have a target for the levels of personal protective equipment that it should maintain in the emergency stockpile. It didn't know the levels that the provinces and territory stockpile had, and it did not advise other levels of government about how much should be stockpiled. Dr. Tam, as the Chief Public Health Officer, were you aware of this situation prior to the COVID-19? And if not, why not?
So I think in terms of personal protective equipment, that wasn't the main focus of the stockpile. It was to look at some very unique countermeasures like smallpox vaccines and other anthrax and other aspects. So in the pandemic preparedness construct, the province and territories also have their own stockpiles, and that they have their own personal protective equipment because they use that all the time. There was definitely a small amount. It wasn't a lot that can potentially help in a very specific situation, but that was not the main focus of NES. And I'm sure that we'll learn lessons, and I think people can decide what should be in the NES going forwards.
So Dr. Tam, when I asked Ms. Thornton to provide this committee with the current state of the NES stockpile, given the news reports of the closure of the Regina warehouse and the discarding of millions of critical PPEs leading into COVID, she responded that she didn't have the critical information available, despite having previously asserted in her testimony before this committee that her department had sound logical systems in place for that. Information gap worries me. So as Canada's medical health officer, are you aware of how many PPEs had been discarded in the shutdown of the 3 of our previous 11 emergency stockpile locations?
Unfortunately, Dr. Tam, we're completely out of time, but I would ask, as I have with other witnesses, if you could provide a very fulsome answer to Mr. Green's questions in writing as soon as possible directly to our clerk.